Esophageal lacerations refer to any sort of cut or tear on the wall of the esophagus. Now, the most common reason behind esophageal lacerations is frequent vomiting or forceful retching. What is retching? Retching is the act of vomiting without the expulsion of vomitus. That's retching. No, I'm not going to do it again. All right. So due to frequent vomiting or forceful retching, there is cut and tear on the wall of the esophagus. How? See, in vomiting reflex, there is development of intra-abdominal pressure. Due to increase in intra-abdominal pressure, the lower esophageal sphincter it opens and the food from within the stomach gets expelled out of the mouth. But since there is frequent vomiting for many times, what happens is that the lower esophageal sphincter gets used to all this vomiting. So even when there is development of intra-abdominal pressure, even when there is development of pressure within the stomach, the lower esophageal sphincter, it does not open. It remains closed. As a result, there is development of pressure within the esophagus. Due to development of pressure within the esophagus, there is pressure trauma on the wall of the esophagus, resulting in cuts and tears and lacerations. Another thing that can happen is that, see, there is development of pressure within the stomach, but the lower esophageal sphincter is closed. Now, due to this increased pressure, the food is trying to come out. But then the food has no way to come out. So it pushes or traumatizes the wall of the esophagus, bringing about esophageal lacerations. Another question. What are the various etiologies or conditions that result in frequent vomiting or forceful retching? You can remember it as A, B, C, F, H. A for alcoholism. B for bulimia nervosa. Bulimia nervosa is an eating disorder where the cycle contains first eating lot of food. So the patient first eats lots of food, but patient now fears in gaining weight. So he or she starts forcefully vomiting, forcefully retching, because he or she does not want to gain any weight. He or she eats lots of food but does not want to gain weight. So as a compensation, starts to vomit forcefully, starts to retch forcefully. C for coughing, F for food poisoning, and H for hiatal hernia. There are two types of esophageal lacerations that you need to know: Mallory-Weiss tear and Boerhaave syndrome. So I've compared both of them in a tabular pattern, but once I'm done with it, I'll show all the points in this diagram and everything will be crystal clear. So for now, just hear me out. First, the type of tear. Mallory-Weiss tear is a longitudinal tear. If this is the wall of the esophagus, the tear, it runs along the wall of the esophagus. Boerhaave syndrome has transverse tear. If it is the wall of the esophagus, the tear is a transverse and perforates the wall of the esophagus. Extent. Mallory-Weiss tear, it is a superficial tear. That is, it only involves mucosa and sometimes submucosa. Boerhaave syndrome, on the other hand, is transmural. That is, it involves the full thickness of the esophagus. The complete wall of the esophagus gets ruptured or perforated. Location. Mallory-Weiss tear is present at gastroesophageal junction. So if this is the esophagus and the stomach, the tear is present around this area. So the tear is present around this area. As a result, the lower part of the esophagus is involved, and sometimes the cardia of the stomach is involved as well. Boerhaave syndrome is around, let me show you. So if this is the gastroesophageal junction, it is around 2.5 centimeter above the gastroesophageal junction. So here's the Boerhaave syndrome perforation. Mallory-Weiss tear, it is more common but less severe. So it requires no surgical intervention. See, it is a superficial longitudinal tear. So it will heal on its own. But Boerhaave syndrome, there's a complete perforation through the wall of esophagus taking place. The esophagus is completely perforated. So stuff from inside the esophagus, like food and air, can leak out of the esophagus and come in the cavity of the chest. So this is less common, more severe. and surgical intervention is required. All right, now focus right here. The two diagrams, it will make everything crystal clear. You have Mallory-Weiss tear and Boerhaave syndrome. Number one, type of tear. Mallory-Weiss tear, it is a longitudinal tear. So it is along the wall of the esophagus. Boerhaave tear, it is a transverse tear. So it perforates through the wall of the esophagus. You can see right here, you can see the other side or a gap present on the wall of the esophagus. Second, location. So Mallory-Weiss tear, it is present at gastroesophageal junction. That is why you can see it extending in the lower esophagus as well as within certain part of the cardia of the stomach. Boerhaave syndrome is present around 2.5 centimeter above the gastroesophageal junction. Number three, extent. So Mallory-Weiss tear, it involves the mucosa, but sometimes submucosa as well. So there is tear through the mucosa and sometimes through the submucosa as well. Boerhaave syndrome, the complete thickness of the wall is involved. There is complete thickness, transmural involvement. So there is completely perforation. You can see the inlet and the outlet. Number four, Mallory-Weiss tear, it is more common but less severe and it can heal on its own. It's a superficial longitudinal tear involving only mucosa and submucosa, so it can heal on its own. But Boerhaave syndrome, it is less common, more severe and requires surgical intervention. It's a tear around 2.5 centimeter above the gastroesophageal junction involving the complete thickness. So there is total perforation. Things from within the esophagus can come out. So it does require surgical intervention. All right. Now Boerhaave syndrome can result in three major complications. Let's see what they are. There are blood vessels within submucosa, right? And if with tear of submucosa, the rupture of blood vessel takes place, there is bleeding. Since in Boerhaave syndrome, there is complete thickness involvement, full thickness involvement, bleeding is to take place for sure. So there will be bleeding. There's gonna be bleeding, 100% bleeding. And all this blood, where will it go? It will come out during vomiting. So there is blood in vomitus, which is called hematemesis. And the act of vomiting is painful. So there is painful hematemesis. Second, there is perforation on the wall of the esophagus. So whatever is present within the esophagus will come in the chest cavity. So there is food will come in the chest cavity. This will result in infection and that will result in inflammation. There is inflammation of the mediastinum, which is called mediastinitis, and it is painful. So you will experience chest pain. Second, there is air. Air comes out. The mediastinum is filled with air, and this is called pneumomediastinum. This air will accumulate under the skin of the chest, so-called subcutaneous emphysema, that is accumulation of air under the skin of the chest. So this you can hear by auscultating. Upon auscultation, crackling sound is heard, and this is called Hammond's sign positive. So three complications. There is painful hematemesis, there is chest pain due to infection and inflammation, and there is subcutaneous emphysema, which is accompanied with Hammond's sign on auscultation. So that's it. One last revision. So esophageal lacerations refer to cut and tear on the wall of the esophagus. The most common reason behind it is frequent vomiting or forceful retching, which can be due to alcoholism, bulimia nervosa, coughing, food poisoning, and hiatal hernia. There are two major types of esophageal lacerations. They are Mallory-Weiss tear and Boerhaave syndrome. In Mallory-Weiss tear, what you see are longitudinal tears. In Boerhaave syndrome, what you see is transverse tear. The Mallory-Weiss tear, it is present at gastroesophageal junction. So there is involvement of lower part of esophagus as well as certain part of cardia of stomach. Boerhaave syndrome is present around 2.5 centimeter above the gastroesophageal junction. Mallory-Weiss tear, it involves the mucosa and sometimes the submucosa as well. Boerhaave syndrome, it involves the complete thickness, that is, there is transmural perforation. Mallory-Weiss tear, it is more common, less severe, and requires no surgical intervention because it can heal on its own because it is simply superficial. Boerhaave syndrome, it is less common, more severe, and it does require surgical intervention because there is complete perforation of the wall of the esophagus. Boerhaave syndrome results in three major complications. Number one, painful hematemesis, that is, there is vomiting where vomitus is seen along there, where blood is seen in vomitus, and the act of vomiting is painful. Chest pain, because since there is perforation, stuff from inside can come out within the chest cavity, leading to infection and mediastinitis accompanied with chest pain. And then subcutaneous emphysema, because air from inside the esophagus leaks in the thoracic cavity, resulting in pneumomediastinum, and then this air will go and collect under the skin of the chest, resulting in subcutaneous emphysema, which can be heard upon auscultation as crackling sound, which is called Hammond's sign positive.